Good morning, everybody. Mark Zusman from Willamette Week. Delighted to be here for another Distant Voices with Jared Walker, who is the founder and executive director of a nonprofit based in Portland called $4. Jared, nice to see you this morning.
Yeah, thank you so much for having me.
So, Jared, you started a nonprofit. I got to ask, how old are you?
I'm 31.
Tell us about your nonprofit and how you got interested in helping people with their medical debt.
Yeah, absolutely. So I, 2012, watched my family go through a medical crisis, and seemed like the biggest conversation was how are we going to pay for it? And I kind of thought, that shouldn't be the conversation we should be having right now. And how can I help? What organizations are doing this? Where can I volunteer to help? When a family has a medical crisis, they shouldn't have to have a financial crisis. That's that's what I'm thinking. But so I couldn't find a single organization that was helping people financially with medical bills, and so I had this idea to start an organization where we get a bunch of people to sign up for recurring monthly donations, and everyone kind of pulls together and we help families in the Portland area. So that's how it started. We have thousands of people that give monthly, and every month we would find families, partner with local organizations, and help people out with their medical bills, or anything medically related. So putting food on the table because they can't work, or paying rent, or whatever that may be, just trying to relieve the financial burden when they're going through the medical crisis. So that's how we started. 2019, we launched a program called Debt Forgiveness, where we advocate for patients that have hospital bills, and enforce charity care laws. So that has really, really taken off. And since last year, we've relieved about $2.5 million for people, just by kind of knowing how the system works and advocating for patients.
So, Jared, fascinating. Let me back up a little bit, and I don't want to invade your privacy too much, but this came about because someone in your family other than you had medical bills.
Yeah. So my wife and I were sitting at home. She got a phone call, and her aunt had passed away from cancer. And she'd been battling for years, and we got that news. And about 20 minutes later, I got a phone call. My cousin had gone into labor 7 weeks premature, and the baby needed a heart surgery to live. So we kind of both got hit with family members that were going through it, and that was a big conversation of like, oh man, how much is this going to cost? And so that kind of struck me as, well, surely someone's doing something about this. And I was kind of shocked to find out that wasn't the case.
How does that work, Jared? Do you put on a suit and tie and you walk into the offices of Providence and you say, will you please retire this debt? Seriously, how does it work?
Yeah, not that, not putting a suit and tie on. So it's really fascinating. So at the beginning, we're paying these medical bills, right? We're raising money and we're paying. And then I realized I can negotiate these bills down. I can stretch these dollars. And one time I was able to just completely get the bill waived. And I was kind of like, man, that's weird. I should try and figure that out. How could I do that more? And I ran into an attorney that had some knowledge on it. And he was like, I'm telling you, man, like this is the best kept secret right now. And like nobody knows about this. And exactly, like the Affordable Care Act goes through, and now every nonprofit hospital in America has to have these charity care laws. And they put it on their bill. They'll say like, if you have problems paying your bill, call this number. But most of the time when you call that number, they're going to put you on a payment plan of some sort. They're not going to extend financial assistance. And how it works is this: we've created a website where a family can can type in their household size, their household income, and what hospital holds the debt. And then it will tell them immediately what they're qualified for according to that hospital's policy. So in Oregon and Washington, most hospitals will forgive up to 300% of the federal poverty line. So if you make anywhere, below 300% of the federal poverty guidelines, the hospital legally has to write off your medical bills.
But that's only if you go to them and say, I want you to write off my medical bills.
Exactly. So what we do
So
is
it requires someone like you to go in and really push them and say, you've got to do this.
It's actually, we fill out the paperwork, we provide proof of income, and then we send it in and we bug them. We call them after 14 days. They should be giving people answers after 14 days. And we just advocate through there. And we even have attorneys that will advocate pro bono if needed. So I'm never walking into the hospital. The hospital knows that it's a federal law that they have to do it. As long as you fill out the paperwork right and provide proof of income, the bills go away.
You sort of fell into this because you saw a couple of family members suffering and you saw an opportunity. But before that, I'm just wondering, where were you headed before this came about?
Oh man, I don't know if I should say that. I was managing a trampoline park
in Portland.
In Portland, I was managing trampoline parks, a few of them. So I just studied business at Warner Pacific and started managing these trampoline parks. And I'd never in a million years thought I'd be in the nonprofit world. I saw a need and thought, well, this would be, I guess kind of a fun side project or whatnot. And here I am. We just celebrated 5 years of officially being a nonprofit. And we're crushing medical bills. So I'm loving it.
So have you found your life's purpose? Do you anticipate you're going to be doing this for a while, or?
You know what? It's hard. I hope not. I hope that I don't have to do this, right? Like the goal is that our healthcare system doesn't need organizations like me, right? It's frustrating that I have to do this, but as long as it takes, I'm going to be here doing it. Like it's the most rewarding work ever. I get to call people daily and tell them that their medical bills are gone. It's pretty impactful. And I'm going to keep advocating for people as long as I have to.